Hey everyone, welcome back to the channel. So today what we're going to go through are the top 3 exercises to treat a rotator cuff injury. Now with any of these exercises, if you've been following along in the previous videos, we want to break these exercises up into different categories. Now we want a couple of exercises or an exercise that are going to handle your injury itself to try and treat the symptoms of your shoulder complaint, make that feel better. We also want to make sure that we're giving you exercises to hit the root cause, the reason why that shoulder's become sore, with the view to making sure that when your shoulder settles down, you've treated both the symptoms and the cause and they go away. So part of the process with these videos is we want to make sure that you understand how you got to the point where your shoulders become sore, and then what you need to do to get back to where you want to be, whether it be using your shoulder normally, just full shoulder function. So one of the things to know about rotator cuff injuries is that they often feel like they suddenly happen, and some do. Some people go from having no pain to pain, but what we often see a lot with rotator cuff injuries is that based on the way that you use your shoulders, the way that you position your shoulders every day, there often tends to be a pre-existing dysfunction there that's asymptomatic until it becomes symptomatic. And it may not become symptomatic for everyone, but those where it does become symptomatic, that potential sudden onset of pain often hides the fact that you're on that path to becoming dysfunctional long before that moment. And when we talk about the exercises to hopefully address some of the root causes of a rotator cuff injury, hopefully it'll make sense to you, and hopefully you'll see yourself a little bit in what we talk about, so that you can make some changes in your life, or at least change your perspective on your shoulder and move away from thinking that it's a sudden injury, even though it can feel that way, and that you went from being normal to abnormal, when in fact it was likely that you were sort of abnormal without realizing it for a while before you got to that point. So basically what we want to do is, the first exercise involves our trusty lacrosse ball. We want to go through the upper back mobility exercise that we've touched on in previous videos, because one of the things that we often forget about the shoulder is that your shoulder sits directly on top of your upper back. That shoulder blade has to move and slide around your upper back as your arm moves. So if your upper back is stiff, not only does it create a bit of a handbrake or a block to normal function, but it creates a set of consequences that then affect the shoulder. So the best way to look at a rotator cuff injury is not that it's an injury to your rotator cuff in isolation, I guess, but that part of your shoulder, which happens to be the rotator cuff, was the part of your entire sort of complex that failed. So it's not that your rotator cuff is a problem in terms of its genetics or its makeup or its inherent capabilities or its properties. It's that was the part of the machine that failed because the broader machine isn't functioning properly. So we want to make sure we're taking care of that when we're trying to fix your rotator cuff pain. So how we do that to start with is we want to make sure that we place the ball into your upper back. And before we do that, we always want to make sure we have a test to begin with. So obviously if you're in pain, stay within your limits. But for the purposes of this video, for me, with my arm, I'm going to take it up as far as I feel comfortable without my rib cage coming up. I'm going to stay nice and square here. I'm just going to come up until I feel like I run out of range, which is about here for me. So pretty close to 180 degrees. So if you can take a mental note of where that is for me, we're going to use the ball to improve that. So we're going to place the ball in between your shoulder blades. Anywhere's fine to begin with, but we want to be basically just to the side of the spine and a fair way in from the shoulder blade. For me, I'm about sort of mid-shoulder blade. And what we want to do here is we want to have your arm up straight. You've probably seen this before. We want to come all the way up and over as far as you feel comfortable. And when you reach your end range, we want to oscillate in and out of that range as far as you feel comfortable. And what you'll find is after no time at all, that arm will start to move further and further. And then what we want to do is we want to move it up a little bit higher. Keep trying to find, that's my tight limit there. Keep trying to find your stiff and tight spots. They'll be a little bit different for everyone. And remember, we're pretty close to the spine here. We're not so close to the shoulder blade yet. So we're trying to influence and bias the upper back joints, the spinal joints. And then what you can do is, once you've made it all the way up towards the top of your shoulder where that first rib or that T1 section is, you might need to lift your bottom up a little bit to create a good angle. So for me here, I'm a bit stiff here. So I'm going to oscillate in and out of this position. And then hopefully in no time at all, that forearm or that hand is going to reach the ground with my elbow straight. And once you've cleared those areas, what you can do is you can come back down again and then move out closer to your shoulder blade. And at this point, it might be a little bit more tender. It'll certainly feel tighter and stiffer, but we're now in the rib cage, and these ribs need to move just as much as the rest of your body in order for your shoulder to function normally. So again, we're going hunting. So arm up, arm over the top. So for me, I tap out here. So I'm just going to oscillate in this position until I feel like it starts to give. And as you can hopefully see more of my face, you'll see that my arm's starting to go further. Again, not because we're mobilizing the shoulder, but because we're getting all this stiffness out the way so my shoulder can just do what it's designed to do. And then again, coming up to that top corner, that first rib, which often gets stiff for a lot of people. So that feels a little bit tender for me. And again, I'm going to oscillate. So I'm stiff at this point, but as I keep going, in no time at all, you'll hopefully see a lot more of my face. And then that stiffness sort of subsides. So again, it's a really, really important part of normal shoulder function is having a mobile upper back. So then if I come back into this same position again, just to see how far my shoulder goes this time, hopefully you'll see there's a bit of a difference. So looking at the camera here, I think I was about here to begin with, just doing that has given me a whole bunch of extra range without needing to extend. So what that's done basically, as I said, it's cleared the path for my shoulder to move a lot more. When it gets quite stiff up here, we often see a position where we're rounding to sort of get around that stiffness. So taking the stiffness away allows that shoulder to be placed into a better position, as well as the shoulder blade being able to move better as we do. Ultimately, it changes the way, improves the way we're loading up the rotator cuff. Again, the rotator cuff is a consequence of bad function. So we need to make sure that that function improves, otherwise that tendon's never going to get a rest. It's never going to get loaded up the way that it's designed for. So the second part of that exercise, using the ball, is we spent some time clearing up the upper back. Now we want to go towards the back of the shoulder, to where the rotator cuff, the back of the shoulder muscles are, that deltoid. We'll basically just place the ball onto the fleshy part of the back of your shoulder, arm out to about 90 degrees. You shouldn't have any trouble finding some tight spots, particularly as you come sort of more under the armpit here. And you might need to roll over towards the ball a little bit. But all I'm going to get you to do is, once you've found a good spot, as I have here, I'm going to get you to internally rotate your shoulder. And what that looks like, as long as your elbow stays on the ground, we're just rotating that hand down, being cautious of not lifting your shoulder up. If the back of your shoulder is tight, when you rotate down, it's very easy for that shoulder to lift up to allow you to move your hand further. So you want to make sure that your shoulder stays on the ball, and we're just taking you through whatever range you have. Same thing as the exercise before, is I feel a little bit tight here. So if I spend some time in this position, in a short amount of time, as you can hopefully see, that rotation improves and my hand and my forearm get further down without that shoulder wanting to lift up. So we want to make sure we're clearing a lot of the tightness at the back of the shoulder. Again, if it's tight at the back of the shoulder, if the shoulder has to deviate forwards, it changes the entire function and the way that any tendon really is loaded in your shoulder. So we want to make sure that the tissues in the upper back and the tissues in the back of the shoulder are becoming looser, so that you've got more room to move, that tendon has more room to breathe, and we can allow that function to return. So any rotator cuff injury treatment exercises has to include a whole bunch of non-rotator cuff specific exercises to improve the function of the shoulder. Otherwise we're missing the point. Otherwise we're not fixing the cause of that problem. So the interesting thing about the ball exercise is, as you're freeing up the tissue around the shoulder, it's going to help the symptoms of your pain and your dysfunction settle down faster. So it's a really powerful way to feed that rotator cuff more slack, take the pressure of it, and help it return to its normal state as quickly as possible. Now, the second part of this exercise, the second exercise in the series, is we've gone after the upper back joints, we've gone after the soft tissue in the back of the shoulder. The next part that we often miss around that rotator cuff is deeper to that is the joint capsule, the shoulder joint capsule. So the shoulder itself is a ball and socket joint. If you wrap that ball and socket joint up in a plastic wrap, like a cling wrap, or some foil, whatever you want to do, that's sort of what the capsule looks like. It encapsulates the joint, but the problem is, one of the things we see a lot is that joint gets stiff. That becomes really tight. So instead of having this really smooth, mobile structure to play with, it becomes glued down a little bit, so you lose some of that mobility, which is what the shoulder's designed to do. And again, the consequence of that, much like the upper back and the back of the shoulder, the muscles at the back of the shoulder, it just changes the way and the orientation of the rotator cuff and puts it at risk of dysfunction. So the second exercise needs to go after that capsular stiffness. And there's a whole bunch of exercises you can do that involve the stretchy power bands, but a really simple one that we can do here, again, it's another one that we've done before, is we want to go after the joint capsule. So you can do this on your hands and knees. And the idea basically is that you want to have your shoulder blades back in a good position. You want to rotate your elbows around so they're facing forward. So you're creating a good, stable shoulder joint. And doing this shoulder here, all we want to do is keeping your trunk parallel to the ground. We want to shift your body weight, your entire body, so your hips and your shoulders across over that side. We want to imagine that the arm itself is pushing out the back corner of your shoulder. You should never feel anything through the front corner of your shoulder. If it's impinging, then you've gone too far. Come out of that position, reset and go again to a comfortable level. But what we want to get you to do is come across until you feel some comfortable pressure at the back, and then come down or over the top of that until you find the best position for you that doesn't hurt your shoulder, no pain at all, but there's a pressure at the back of that shoulder where you're sort of biasing the capsule. Now, if you want to do this a little bit more specifically, we can do the same thing, the exact same thing on your elbows. It just takes the elbow joint out of it, shoulders back, shifting across, hunting around until you feel like you've got something that feels nice and tight. Spending some time here. You can play around with the position of your forearm to give it some more internal or external rotation, but just be aware that as you rotate inwards, if you're already tight and stiff at the back here, you're more likely to dump into a bad position and irritate that shoulder. So stay within your comfortable window. But then again, what we should find is, and hopefully this is better again, when I take my arm up again, it feels like it goes, at least it feels freer. I don't know if it goes any further visually, but it feels like it moves better. So exercise number 2 is the shoulder capsule joint stretch. Pretty simple. So those 2/3 exercises will hopefully give you an infinitely better range of motion to play with. Feed as much slack into that shoulder as possible, allowing it to free up and settle down quickly. Now, the final exercise that we want to touch on is, we know about the rotator cuff strength exercises where you grab a band and you rotate that band backwards and forwards from a good posture. Clinically, it's an okay exercise to strengthen aspects of your rotator cuff, but the problem I have with it is it isn't functional. There aren't too many things that you do day to day that require that movement, and the rotator cuff itself, its main role is to stabilize your shoulder. So instead of giving you the basic rotator cuff exercises, we want to put it into context so that it's more functional for you. And a great exercise for that is putting some weight through your hands. So similar to the shoulder capsule stretch, we're going to get you into a push-up position. Again, shoulders back, elbows rotated forwards, and we want to just hang out here. So if this arm is one that's a little bit sore for you, make sure there's no pain. But if you come across to that side, almost like you're going to do a one-arm push-up, you can take this hand away if you want to. You can stay here for 30 seconds to a minute. If it's too hard for you, feel free to drop down onto your knees and just do it from one arm. We want to spend time in a good shoulder position, asking your rotator cuff to stabilize. Now, this is a great progression for the patients that I see, because eventually we want to get you up onto your hands in some form of a handstand if possible, which may sound a bit of a leap for most people that have those problems, but whether you're in a push-up position, whether you're in a push-up position with your feet up on something, you want to make sure that you're spending time asking your rotator cuff to safely stabilize and work together with your upper back muscles to put that shoulder in a good position. So if you can practice that where you start to fatigue, again, bouts of 30 seconds, 3 sets of 30-second holds or a minute hold, depending on your capabilities, is fantastic. They're 3/4 fantastic exercises that I would get anyone to do and master to make sure that their rotator cuff symptoms die down, put in a better position, and can function better over time. Now, if you have a genuine tear in your rotator cuff, there's every chance that it's going to take some amount of time for that tear to heal. Some people may need surgery to reattach that tendon, but all of these exercises still apply at some point in your rehab, because if you can't do them, or if you haven't mastered them and you're leaving some stiffness and some tightness or some joint stiffness or some weakness on the table, it's hard for that rotator cuff to magically feel fantastic forever, which is what we're here for. So hopefully those exercises give you something different to think about. If you have any questions, let us know in the comments below. I want you to ask me things. Please feel free to. I'll do my best to answer them appropriately. Please leave a like on the video if you felt it was useful. Consider subscribing, obviously, just to help support the channel, help these videos find more people. And as you may know, we're trying to put them out daily or as close to daily as we can, just to help as many people as possible. So if you have any requests, and a lot of people have, which is great, please let us know in the comments or private messages to let us know. But until tomorrow, until next time, we'll see you soon. Bye.